welcome to Paramedic Project, and thanks for joining us. Last time we talked about the importance of a primary survey, and today I just want to expand on one or two elements of that primary survey and just talk about that a little further. So we talked about taking a respirate on a conscious patient, and after introducing yourself and gaining consent to actually assess the patient, we were holding the wrist and looking at the chest with their watch in the foreground, the chest in the background. Now that's fantastic, but and I know that most people, when they assess a respirate, especially when you're starting out, will count that respiratory rate for 15 seconds. And once you're used to taking a respiratory rate, you can cut that down a little bit. And what I like to do is I like to count the number of seconds between breaths. So one breath comes as a pause. When the next breath comes, we can stop counting. So if it's 6 seconds between breaths, we can say the patient's got a respiratory rate of 10. If it's 4 seconds between breaths, then there's a respiratory rate of 15. If there's 2 seconds between breaths, it's a respiratory rate of 30. So that just cuts down a little bit of the time that it might take you to take a respiratory rate, and it's just guides your assessment a little further. Now, for me, that information I get back from the respiratory rate in the primary survey, that then really it really piques my interest about what's going on in their respiratory status assessment. So that then means that if they've got a slow respiratory rate, then I'm really keen to get to that respiratory status assessment and fill in tick all those boxes of their respiratory status assessment and see what's going on. Same if they've got a really fast respiratory rate, then it really is like a mental note for me to get to that respiratory status and really assess it thoroughly as well. Second part of the assessment I want to talk about is taking this peripheral pulse. Now, a lot of people might say that yes, you can get a pulse rate from an SpO2 monitor or a SATS probe on the finger. Actually, taking a peripheral pulse is much more than just getting a pulse rate. First of all, it allows you to touch the patient, which allows you to break down some of those barriers between paramedic and patient. And those barriers are ones that are really hard to overcome when you're starting in the profession. You're not really comfortable going up to strangers and touching them, so it's important that on every patient you do touch them. And I'd even go as far as saying that if you haven't touched the patient, you haven't completed your primary survey. So that's really important. And obviously it does give you a pulse rate, but it also allows you to feel the patient's skin. It allows you to feel if they're hot or cold, whether they're clammy or their skin's dry. And those points really then lead into our perfusion status assessment. And once again, if there's something irregular about that, the patient's very clammy, then I'm really thinking into the perfusion status assessment, and I'm wondering what it's going to then give me, so it's another mental note to complete that assessment fully as well. So there are two more tips that you can implement into your paramedic practice, and once again, thanks for joining us, and find us on social media.